Seasonal allergies, sometimes called hay fever, can be brought on by inhalation of pollen. Pollen by itself is not harmful. However, the allergic reaction it causes in our bodies is what causes sneezing, nasal congestion, sinus pressure, coughing, and other problems. Signals are sent out by your body to cause the release of histamine, which increases blood flow and inflammation. It sends a signal to your brain to cause you to sneeze in order to remove the pollen or other irritant particles. When this happens, you start producing more mucus, which can cause your nose to become stuffy, your eyes and nose to become runny, and you may start to cough. Additionally, histamine can cause irritation to the throat, nose, and eyes. Fortunately, there are some easy and effective home remedies that can help relieve spring allergy symptoms. Remedy number 1: nasal rinsing or neti pot. Rinsing the sinuses can help reduce spring allergy discomfort by removing dust, pollen, and other debris from the sinuses, in addition to assisting in the thinning of thick mucus. Additionally, it can help relieve nasal symptoms caused by sinus infections, other seasonal allergies, the common cold, and the flu. Rinsing your sinuses with a saline solution, whether it be one you make at home with salt water or one you buy already prepared, will physically flush out any allergens and irritants that may be present, therefore reducing the strain placed on your immune system. Don't use regular tap or bottled drinking water because it likely has a different pH than your body does and will make you feel uncomfortable because of the difference. If you prefer to make your own rather than purchase a neti pot, here's a saline rinse formula and recipe you can make and use at home. Ingredients: 1. Salt used for canning that does not contain iodine, anti-clumping agents, or preservatives. These are an irritant for the nasal cavity. 2. Baking soda. 3. 8 ounces, 1 cup, of lukewarm water that has been distilled or boiled. Combine 3 teaspoons of iodide-free salt and 1 teaspoon of baking soda in a clean container. Then transfer the mixture to a small container with a lid that can keep air out. Mix in 1 teaspoon of the mixture to 8 ounces, 1 cup of warm distilled or boiled water. Stir until the mixture is completely dissolved. If you are experiencing any burning or stinging sensations, try diluting the solution by using fewer of the dry ingredients. The recommended dosage for children is a half teaspoon mixed with 4 ounces of water. To use the rinse, follow these instructions while using a squeezable ear bulb, an infant nasal bulb, or a commercial nasal saline rinse product purchased from your local drugstore. 1. Squeeze the air out of the bulb and suction saline into it. Turn your head to the left while bending your head forward over a sink or while you're in the shower, applying the solution to the left topmost nostril with a light and gentle squeeze. This should yield approximately 4 ounces. Maintain a normal breathing pattern through your mouth. In a few moments, you ought to be able to breathe out the solution through your right bottommost nostril. Let the saline solution drain from the right nostril. Turn your head to the right and then carry out the previous steps again. Applying the solution to the right nostril, draining from the left. 2. Make any necessary adjustments to the position of your head so that the solution does not go down the back of your throat or into your ears. 3. Give yourself a very light blow through your nose to avoid getting the solution in your ear, which could be very uncomfortable. 4. Following the application of the rinse, you should resume using your regular nasal medications as directed by your doctor. You might discover that they perform more effectively. If your nose is really clogged up, you shouldn't use sinus rinses. When thinking about using a sinus rinse, it's important to talk to your primary care doctor first and stop using it if you feel pain, get nosebleeds, or have any other problems. Remedy number 2: steam inhalation. Take a deep breath of the steam. This easy tip can help relieve stuffiness in your nose and make it easier for you to breathe. Keep your head over a bowl or sink full of warm, but not too hot, water, and place a towel over your head to trap the steam. Hold this position for 5 to 10 minutes. You could also try going into the bathroom and starting a warm shower. If you have access to one, a steam room is an even better option because steam helps to tamp down and displace any outside particles. Steam rooms can present a safe environment for your body to naturally eliminate allergens and dust, both of which can aggravate your symptoms. Steam rooms encourage slow, deep breathing, which can help clear the lungs and open up the airways. Using an essential oil like lavender or eucalyptus along with the session in the steam room may be the best thing you can do to get rid of persistent respiratory allergies. Remedy number 3. Use a high-quality air filter. Air filters can be an effective tool in reducing the occurrence of allergies in the home. They work by capturing and trapping airborne particles such as pollen, dust, and pet dander before they can be breathed in. By removing these allergens from the air filters can help reduce allergy symptoms such as sneezing, itchy eyes, and a runny nose. To use an air filter to reduce allergies, it is important to choose the right type of filter and use it correctly. Here are some tips for using an air filter to reduce allergies. Choose the right type of filter. There are several types of air filters available, each with its own level of effectiveness. The most effective type of air filter is a high-efficiency particulate air. HEPA, which is capable of capturing particles as small as 0.3 microns in size. People with severe allergies should use HEPA filters because they are very good at catching allergens in the air. Another type of air filter is an activated carbon filter, which is effective at capturing odors and chemical fumes. Even though activated carbon filters might not be as good as HEPA filters at getting rid of allergens in the air, they can still help reduce allergy symptoms. Choose the right size filter for the room. When choosing an air filter, it's important to select the right size for the room. The size of the filter is measured in terms of its clean air delivery rate, CADR, which is a measure of the amount of air the filter can clean in a specific amount of time. To determine the appropriate CADR for a room, multiply the room square foot by 1.5. For example, a 200 square foot room would require a filter with a CADR of at least 300. Run the filter continuously. To get the most benefit from an air filter, it should run continuously. This means that the filter should be left on 24 hours a day, 7 days a week. Running the filter at all times removes allergens from the air all the time, which can help allergy symptoms. It's important to remember that leaving an outside door or window open to the room with your air filter will cause it to have to work much harder to clean the air in the room. Change the filter regularly. To make sure the air filter is working as well as it can, it should be changed regularly. The frequency with which the filter needs to be changed will depend on the type of filter and the level of pollutants in the air. As a general rule, HEPA filters should be switched out with new filters every 6 months to 1 year. Activated carbon filters, as a general rule, need to be changed more often, depending on how heavy the usage is. Here are 5 powerful and natural antihistamines that are easy to acquire. 1. Stinging nettle. A common herb used in alternative medicine might also be a natural and effective antihistamine. In a study that was reported in the July 2000 issue of Integrative Medicine Alert, 58% of participants reported that the use of freeze-dried nettles provided moderate to highly effective relief for their symptoms. You can purchase stinging nettle both on the internet and in health food stores. The participants in the aforementioned study consumed 300 milligrams mg on a daily basis. Women who are pregnant should not consume or use stinging nettle because it can potentially cause uterine contractions, which can increase the risk of premature labor or a miscarriage. Before consuming stinging nettle, you should consult your primary care physician if you are currently taking any of the following medications: drugs that thin the blood, or medication for treating high blood pressure. 2. Quercetin. This is one of our absolute favorite supplements. Not only does it have powerful antihistamine properties, but it also gives you an immune boost. Onions, apples, and other fruits and vegetables all naturally contain trace amounts of an antioxidant called quercetin. The antihistamine properties of quercetin have been demonstrated through research. A 2007 study found that it even helped reduce the negative effects of respiratory allergies in rats by lowering the inflammatory response in the airways. You can get quercetin in the form of a supplement, or you can just increase the amount of foods in your diet that are rich in quercetin. 3. Vitamin C. Vitamin C is a natural antihistamine that helps reduce inflammation and boosts the immune system. You can increase your intake of vitamin C by eating fruits and vegetables like oranges, kiwis, strawberries, and bell peppers. Alternatively, you can take a vitamin C supplement. 4. Bromelain. Bromelain occurs naturally in pineapples. However, you can also find it in supplement form. It is effective at treating the respiratory distress as well as the inflammation that is associated with allergies. According to a study that was done in the year 2000, the recommended dosage is between 400 and 500 milligrams 3 times per day in supplement form. The easiest and sweetest way to get bromelain is through the consumption of pineapple. 5. Butterbur. Butterbur is a type of plant that grows in marshy areas and belongs to the daisy family. It can be found all over Europe, as well as parts of Asia and North America. According to research, not only could it be helpful in reducing the severity and frequency of migraine attacks, but it could also be useful in treating nasal allergies. According to the findings of other studies, taking butterbur supplements can help people with allergies experience a reduction in the severity of their symptoms. Butterbur is available both as an oil extract and as a pill form for consumption. Click subscribe and the notification bell so you get more videos on the best home remedies and health tips. Spring allergies can be frustrating, but with these home remedies, you can find relief without resorting to medication. Try these remedies and see which one works best for you. Let us know in the comment section. Make sure to talk to your doctor before trying any new treatments, especially if you already have a health problem. Thanks for watching. Please be well and take care.